Hi, I'm Ari, and I'm a strong supporter for the Death with Dignity law. As of February 2017, California, Colorado, District of Columbia, Oregon, Vermont, and Washington all have the Death with Dignity law. This law allows individuals who are terminally ill or have a medical reason to end their life when they choose to. They receive a prescription medication to end their life. This law allows people to feel that they have the rights to their own life. All humans should have the right to choose when to end their suffering when they are terminally ill. The Death with Dignity law ensures that people can die on their own terms. The people who choose this option are not electing to die. That choice has already been made for them. They are just ending their life earlier than if they waited. The Death with Dignity provides another end-of-life option for terminally ill patients to voluntarily request and receive a prescription medication so that they can die in a manner, time, and place of their choice. In the United States, we have covered up the topic of death for years. You can't avoid death, but you should be able to make the choice of when death will come. The question that many people want to know is it ethical to be able to end your life on your own terms? The Death with Dignity law doesn't just allow anyone to be okayed this medication. To qualify under the Death with Dignity statuses, you must be an adult resident of the state where such law is in effect, mentally competent, capable of making and communicating with your healthcare provider, making your own decisions, and being diagnosed with a terminally illness that will lead to death within 6 months, as confirmed by 2 physicians. The process initials 2 oral requests, 1 written request, waiting periods, and other requirements. Many patients suffering from terminally illnesses long for a sense of control. They have been overcome by diseases and desire the ability to control their death and not let the disease win. Also, some patients obtain the medication but never end up using it. They just like having the comfort of being able to have it and have the peace of mind of knowing that they can use it if they want. We are taught to make our own choices throughout life. No one makes the choices of becoming terminally ill. Everyone has a choice to vote when of age or drink when of age, but most states don't have the choice to have a prescription drug when terminally ill to end their life. Having the peace of mind, knowing that you have the option of the drug, sets your mind at ease. We all are quick to judge any topic that comes up in society. Everyone tries to make decisions for others, not just themselves. As an individual, we have the rights to make our own choices. Once patients have the medication, they may use it as directed, and knowing that using the medication is voluntary. The medication costs between $500 and $3,000, and the cost of medication is a pro because of how cheap it can be to end suffering. The medication is available in a powder or a liquid form, and within 5 minutes of taking the drug, you will slip into a coma. Within a half hour, you will be pronounced dead. If you are in good shape or overweight, the drug can take up to 48 hours to end up working. You can self-administer this drug by ingesting the medication at the place of your choice where you are comfortable, though the law advises your physician to ask you not to do it in a public place. More than 95% of the people that decide to take this drug are in their own home, where they feel comfortable. The other percent of people decide to take the drug in a nursing home or a assisted living home. When taking the drug in your household, it allows a peace of mind, and you're with your loved ones. You are able to be comfortable and be in rooms that are familiar to you and where you feel safe. For qualified patients, you must wait at least 15 days between signing the first oral request and signing the first written request. The attending physician must wait at least 48 hours between the date the patient signs the written request and waiting the prescription for medication under this act. With having these time gaps, it allows the patients to not just make a spontaneous decision, This time period allows the patient to really think things over and to make sure that they're making the right choice for them and for their family, and that they really want to go through with it. They're able to gather their emotions and make sure that they truly want to do this. It is never about pain for these people. It is more about having the dignity and being able to die in peace with having dignity and not being in pain anymore, and knowing that when you are terminally ill that you will be passing away and you should have the right to choose when you want to end your life. So I believe that the death with dignity law allows individuals to have control of their life and make decisions on their own that sometimes you cannot make on your own.